There can often be an increased amount of interplay between different types of diseases and the effect they have on our sleep. On today's episode, we will talk about acid reflux and its scary big brother, gastroesophageal reflux disease. I'm Jay, and this is Somnilopod. Hello, everybody. Welcome back from the holidays. I hope you had a nice, restful, relaxing time. And I'm sure if you're anything like me, you did quite a bit of eating. Yeah, there wasn't anything that I didn't eat. So I may or may not have experienced a little bit of reflux as a result of it. I think we have all experienced reflux, acid reflux on occasion, and it is basically just the acids in our stomach leaking back up into the esophagus, and it can cause some irritating symptoms. Usually, it's a burning sensation in the chest. Sometimes it can even be associated with chest pain, difficulty swallowing, regurgitation of that sour liquid, and even a sensation of like an obstruction or a lump in our throats. Now, acid reflux does occur occasionally to many of us, but it really depends upon how much it occurs as to whether or not it develops into something called gastroesophageal reflux disease. Typically, physicians will look at the frequency during the week, and if it's typically 2 or 3 times per week that it is affecting you and you're having to take over-the-counter medications at least that frequently, then they may want to bump up that diagnosis and investigate getting that taken care of a little more consistently for you. Now, there are some things that can contribute to acid reflux. Things like obesity. Watching our weight can help with reflux symptoms. Also, there is a fairly common type of hernia called a hiatal hernia that studies have shown exist in about 40% of adults in North America and Europe. And those numbers actually increase as we get older. So that's something to keep an eye on as well. And pregnancy. Ladies, you've probably experienced it yourselves. Acid reflux can increase during pregnancy. There are also some behaviors that can affect the chance of reflux. For example, smoking. Smoking can increase your risk of having reflux. Eating large meals at night, that's sort of a no-brainer. I think we have all experienced that. Eating certain foods, such as excessively fatty or fried foods, can increase your chance of reflux. And certain beverages, alcohol and coffee, can increase your chance of reflux. And this I know from personal experience. The coffee part, not the alcohol. Well, maybe the alcohol too, but the coffee part in particular does give me a little bit of heartburn if I drink too much coffee, as well as make my heart race. And that is bad for me, so I should watch that. There are also certain medications. Interestingly, aspirin. Just taking aspirin can increase your chance of reflux. So there are some things that you can do lifestyle-wise that could reduce your risk of having reflux and it developing into a gastroesophageal reflux disease. Reason I mention all of this is because a lot of patients experience acid reflux at night. Those symptoms can often be worse, but they can also be associated with other types of sleep disorders. So patients that have nocturnal acid reflux can often experience these symptoms, of course, when they're laying down. The two best things to help keep us from having acid reflux are gravity and normal swallowing. Of course, when we're laying in bed, gravity is a little bit affected there because we're laying flat, typically. Also, the swallowing reflex decreases during night while we're sleeping. So we're not swallowing as often as we would during the day. Now, some of the other symptoms that can affect patients that have nocturnal acid reflux, a chronic cough. A lot of patients will report experiencing that. Laryngitis, an effect on their voice, even new or worsening asthma, and, of course, disrupted sleep. One of the things we see is that patients who have excessive reflux at night and gastroesophageal reflux disease, their sleep is often disrupted if they're not being treated appropriately. So that will lead to excessive daytime sleepiness, as well as difficulty concentrating and just the general effects of sleep deprivation because they're not getting the good consistent sleep that they need. Now, there has always been research into an association or a possible causal relationship between reflux disease and obstructive sleep apnea. Now, the research isn't conclusive on this yet. They do know that a lot of patients who suffer from sleep apnea also suffer from reflux disease, and vice versa. There are several different theories the scientists are investigating to try to explain some of this. For example, one of the theories suggests that the intercostal or the interabdominal pressure from obstructing the airway when we're trying to breathe can affect the ability of the lower esophageal sphincter, and that's the sphincter that closes the top of our stomach. But it can affect whether or not fluid can come back up through that sphincter. Also, other theories suggested that there is a relationship between awakenings from sleep, nocturnal awakenings, and the effect that those can have on reflux. And interestingly, another theory even suggests that it could be the acid from reflux affecting the upper airway, causing edema or swelling, which would make the airway more likely to close off with sleep apnea. So research does continue into whether or not there is a causal relationship, but we do know that patients often report both of those things. So interestingly, treating one can often affect the other. Studies have shown that patients with sleep apnea, once their sleep apnea is treated, their reflux symptoms can be reduced. And in addition, patients who have their reflux treated, their nighttime symptoms are reduced as well. So we do know that there is something happening, and it could be just that our bodies are amazing things, but scientists will continue to have a look at that and see if they can't get things figured out for us. I hope this has been interesting for you. If you have any questions, comments, concerns, please send those to me at j@somnilopod.com. You can also check out other episodes in the archives through most of your streaming podcast services. You can also look at some new content on YouTube. I've been trying to work on that during the holiday break, so I've got that up and running. So please check that out. Let me know what you think. Give it a thumbs up and a subscribe. That would be great. So until we talk next time, please remember to try to make sleep a priority. Thanks so much.